So, what brings you here today?
Okay, so I'm at a bit of a loose end, really. I've had this problem for like 2 years with my knee, and I've seen countless people. I've been to many a physio, chiropractor, etc. And I have, and I have been seeing a physio over the last 4 months. But I just kind of wanted to come and get a different opinion, see if there's something that they might have missed or whatever. So it started 2 years ago. I was literally walking along. I was training a client at the time, and I like turned to the side, like not like abruptly. It was literally just a turn, just a slight turn, and then it literally, my leg just like gave way. Like my knee just felt like something just kind of like popped out of place.
And what did that pain feel like?
So it was like a really sharp pain, and then afterwards it was like really hard to like bend the knee.
Did you have any swelling?
Yes.
A lot of swelling or a little bit of swelling?
Quite a bit of swelling. My knee is still kind of fat now.
And is there anything that actually makes your symptoms worse? Things you cannot do?
So if I'm doing, like any jumping movements and things like that, because my job is, like, I'm a personal trainer, so I do boot camps and stuff. Not anymore at the moment, but I was like jumping about and doing obviously like squats and lunges and things like that.
And that aggravated your knee?
And that would aggravate the knee.
I've seen knees like yours before, and it's very, very hard to diagnose, if I'll be honest with you, especially if you've had the MRI so recently, that essentially showing things so that your patella is slightly high.
Yeah.
What does that mean?
Yeah.
Can you do anything about that? What do you have to strengthen to lower your patella?
Yeah.
But you could do this okay, that doesn't hurt.
That's fine, yeah.
Okay.
I've got a clunky hip as well.
Yeah, and the thing is with clunks, I'm almost okay with that. Like, clicks and clunks are quite normal for people.
Yeah.
I know you don't want to hear a clicking in your knee, and
it just
the left
sounds
knee,
horrible, doesn't it?
yeah, it sounds horrible, and the left knee doesn't do it, I get that. But really, and I can feel it clunking, don't get me wrong, I can feel all of that when you're doing this. But what I think that clunking is purely tendons flicking over bony tubercles. That's all it is. So what I'm going to do today is quite similar to the chiropractor in a way. I'm going to loosen everything up big time, in a kind of general way. I don't think you have a specific thing. I don't think it's to do with your arches and your heels and your knee turning in or anything like that. I think this is quite normal. I know it sounds crazy, I know it sounds weird, you have to almost ignore that, because if you stop for every little clunk and click, you will not ever work out again, I promise you.
So this is where it obviously gets confusing, because like the physio said to me, don't do it if it clunks and crunches. So
I would disagree with that wholeheartedly. Like, that is insane, personally, in my opinion, okay? If you just contract your quad for me, good. Is that okay?
Yeah, it's fine.
Good. The only thing you have to worry about is snapping knee syndrome. The only thing that you should worry about and that's when you stop, when you have IT band syndrome. But see, you're going to have to either listen to me or listen to the physio. But if you listen to the physio, well, like I said, I think you could start squatting it. I think there's no reason for you not to squat. Clunking is normal. Okay? In your lower back, okay?
Whoa.
Perfect. And have a lay onto your back for me. Did the chiropractor do that one?
Yeah. Not to that extent though.
No.
A little.
A little. I'm aggressive like this.
Yeah, I was like, whoa.
Okay, so the way we get into the psoas, it's just over here. Okay, so it's a bit of an awkward one, but it's just kind of in here. So the psoas actually attaches to the spine and then goes down. Then there's a muscle here called the iliacus, and the psoas and the iliacus kind of form to make the psoas major.
It's not a very nice muscle, is it?
No, yeah. So to get in there, you have to like go deep in. Okay, it's really tough. That's what I'm saying with a ball. You can't really get in there. You have to use something pokey. The days that I work here, I was taking like 3 hours out of my day to just go down to the gym, box a little bit, and come back.
That's good.
And it was just, in the ring, pads, boxing, sparring, on the punch bag, everything. We were doing everything. It was horrible. I'm going to do another little manipulation. Okay, you might hear a little pop of crackle as well. And breathe. Well done. And I can't tell you how many people come through Instagram. It's unbelievable. Just 1 second, just relax. Let this drop. Perfect. And have a length to your back, please. Even for someone like you, your trade. Not good.
Oh, that's horrible. Oh, that's even worse. Something so satisfying about it.
Now we've got to come on to the neck manipulation, if that's okay.
No. Oh, this is what I'm freaking out about. Okay.
We'll be fine with this. So first I'm just going to have a feel of your neck just to make sure everything's okay. Okay, cool.
Oh.
Perfect.
Jeez.
And just ignore the clunking for the time being.
Yeah.
Don't be put off by it, just understand that it's quite normal.
Okay.
Because I fear that if you go searching for what's wrong with your knee, you're going to be searching for very, very long. You're going to just go from therapist to therapist, trying to figure out what's wrong, and I'm trying to tell you that there's nothing really wrong with it, other than a slightly high patella. I don't even know how high the patella should be sitting, if I'll be honest. They're saying it's like a cent, I don't know. But as I'm moving it, it feels okay. It's like I say, albeit slightly small.
Yeah.
Cool. Alrighty then, madam. We're going to leave it there for today.
Lovely.
Cool.
Thank you.